Hello, and welcome to Jack Houston Memorial Hospital. I'm Jessica McLean, your clinical nurse navigator here at Jack Houston. As your nurse navigator, I will be guiding you all the way through the surgical process, from the initial stages of pre-appointment scheduling to checking on your recovery after surgery. I will be communicating with you frequently via phone calls and text messages to ensure this process goes as smoothly as possible. By viewing this video, you have already begun an important first step, and that is educating yourself on what to expect during this experience. As a nurse navigator, ensuring you are prepared for surgery is one of my most important tasks. Before surgery, you will want to ensure that you have all necessary equipment for use after surgery, such as a walker. If you already own such equipment, please remember to bring it with you on the day of surgery. If you do not own the necessary equipment, please obtain a prescription from your surgeon and pick the equipment up prior to the day of surgery. Before surgery, you will also want to designate a family member to be your care partner. Your designated care partner will be an important member of your care team. They will assist you with your care and other activities during your recovery. We hope this video helps you prepare for your upcoming surgery. Thank you again for choosing Jack Houston Memorial Hospital, where excellence is always our goal.
Welcome to the pre-admission testing department. You will be receiving a phone call from our nursing staff prior to your surgery date. We will be asking you about your medical and surgical history and medications. We will need to know the names of the medications you are taking, the dosage, and how often you take them. We may also ask about any recent blood work or heart testing that you may have had. I know it may feel that you have already answered 1,000 questions for this surgery, but please be patient with us. Our job is to make sure that your care team has all the correct information they need to safely take great care of you. To provide for your hospital visit, we would like for you to leave your medications and valuables at home. Make sure you pack comfortable clothing. If you use a CPAP machine at home, bring it with you. Also, bring your walker if you already have one. One of our main goals at Jack Houston is to prevent infections from occurring. Before surgery, if you smoke, please quit. Do not shave near where you will have surgery for 3 days before the surgery. The night before and morning of surgery, bathe or shower with dial soap. After surgery, make sure that everyone is cleaning their hands. If you do not see them clean their hands, please ask them to do so. A hand sanitizer wipe will be provided with every meal for you to clean your hands. When you go home, make sure you have hand sanitizer available. If friends or family are sick, ask them to postpone their visit until they are feeling better. Do not allow pets to come in contact with your dressing or wound, and clean your hands after touching your pets. Call your doctor if you have a fever above 101 degrees, drainage from the wound with pus or odor, or if you have redness with warmth around the incision.
Hello, my name is Justin Fussell and I'm one of the pharmacists here at Jack Houston Memorial Hospital. Our goal is to provide you with excellent care throughout the surgery process. This is going to begin before you arrive and continue after you return home. Our desire is to have the best possible outcome for your surgical procedure, to minimize any complications, and to provide the safest and most efficient care possible. Please bring an accurate and current list of your medications with you to surgery that should include the name of the drug, how often and when you take it, and the dose. Check with your surgeon about continuing anything from the following list of drugs and when or if you should stop taking this medication. This list is not exhaustive, so please ask about any other medications you might have concerns about. Anti-inflammatories such as ibuprofen, celecoxib, or ketorolac. Anticoagulants or blood thinners such as clopidogrel, enoxaparin, or warfarin. Any herbal medications or any over-the-counter medications.
A member of our patient access team will be contacting you prior to the day of your surgery to validate insurance information and personal information. At this time, they will also discuss any financial responsibilities you may have based on your insurance. The morning of your surgery, you will be greeted at the front desk by a patient access representative. They will place an identification band on your arm while confirming your name and date of birth. All staff will confirm your name and date of birth using this armband as part of our safety protocols. You will then proceed to the front elevators to second floor surgical waiting room to notify staff of your arrival. Please ring the bell located to the right immediately preceding the double doors, and you will be allowed entry to the outpatient nurses station. Welcome to outpatient. Don't let the name confuse you. This is where all patients are prepped for surgery. When you first arrive, initially we will only allow the patient back, except for special circumstances. During this time, we will clip any hair from the surgical area, prep you with our nose-to-toe skin wipes and nasal swabs, place you in a patient gown. We will review the information on your chart with you, assess your vital signs, begin an IV, and complete any testing that is needed. For your safety, you may be asked multiple times to state your name, date of birth, allergies, the procedure you are having, and to verify your surgical site, and then provide you with a warming device. After you are prepped for your procedure, your visitors are welcome to see you. The anesthesiologist will see you during this time to discuss your anesthesia plan. The surgeon or his designated team member will also see you before surgery to verify the correct procedure and surgical site and to answer any questions you may have.
Hi, I'm Dr. Prater and I'm here today to talk about joint replacement surgery. Specifically, what happens during a total hip and total knee replacement. Joint replacement surgeries are some of the most common procedures performed by orthopedists today, with nearly 1 million being performed in the United States on an annual basis. Overall, both procedures are very successful and patients are generally very happy with the results. Let's start with talking about total knee replacement. Osteoarthritis occurs when the articular cartilage or smooth surface on the ends of the bones starts to wear out. As arthritis progresses, the cartilage becomes roughened, the joint space narrows, and in some cases it wears out completely, bone-on-bone arthritis. This causes pain, decreased mobility, and deformity of the legs. They sometimes become bowed or knock-kneed. The goal of total knee replacement is to eliminate pain, improve mobility, and when possible, correct the deformity. Total knee replacement surgery usually takes less than an hour. Almost all total knees are performed through an incision centered over the front of the knee. We often use a tourniquet as well as a special tool called a bovie to minimize bleeding during surgery. During a total knee replacement, the worn out articular cartilage is replaced with new metal and plastic components. One of the big misconceptions about a total knee replacement is how much of the knee is being replaced. It's actually more of a resurfacing than a replacement. In general, only a few millimeters of bone are removed. The surgeon will use your preoperative x-rays and physical exam to formulate a preoperative plan. This helps determine where to make the cuts and how much bone needs to be removed. Then, during surgery, specialized alignment guides and jigs are used to make the bone cuts and confirm the exact size and position of the implants. Once all the cuts are made, the bone surface looks something like this: smooth surfaces with squared off edges, perfectly matched to accept the new metal components. Trial components are placed first and the knee is taken through a full range of motion. We look to make sure that it goes all the way straight, it bends all the way back, and it doesn't have too much slack. It's much like taking a new car for a test drive. An x-ray is frequently taken at this point as well to confirm positioning. Once everything is exactly where we want it, the trials implants are removed and the real implants are placed. These implants are affixed to the bone with either a bone cement or a roughened backing on the components that allows for the bone to grow onto it. Your knee gets one more test drive and then the wound is closed in layers and a dry dressing is placed. Now let's talk about total hip replacement. The disease process for hip osteoarthritis is very similar to that of the knee. The joints, however, are quite different. The hip is a ball and socket joint and thus poses a very different set of challenges. Just like in the knee, as the arthritis progresses, the articular cartilage roughens, thins, and eventually will wear out completely. This will cause progressive pain and decreased mobility. During hip replacement, the worn out ball and socket are replaced with new metal and plastic components. The goal of hip replacement surgery is to eliminate the pain and restore function. Hip replacement surgery takes roughly an hour to complete. The big difference here is that there are several options when it comes to approaching the hip. You can come from the front, a direct anterior approach, from the side, a lateral approach, or the back, a posterior approach. Despite what you may have heard, studies have shown little difference between them and excellent outcomes with all three. Each approach can be performed in a minimally invasive fashion, and each has its own advantages and disadvantages. Your surgeon will discuss these with you beforehand and help you choose which approach is best for you. No matter which approach is used to get to the hip joint, once there, the surgery and components for all three are exactly the same. During surgery, the hip joint is first dislocated and the femoral head or ball is removed, making room for the new components. Specialized tools called reamers and broaches are used to make very accurate cuts and to prepare the bone to accept the new components. The acetabulum or socket is replaced with the hemispherical metal cup. This cup has a roughened back that allows the bone to grow onto it. Sometimes we use additional screws to increase the stability. Once this metal cup is secured, a plastic liner is then inserted and locked into place. A metal stem is then placed into the femur or thigh bone. Just like in the knee, we first use trial components to make sure that everything fits properly. We take the new hip for a test drive, checking for range of motion, stability, and to make sure that the leg lengths are equal. An x-ray is taken at this point as well to confirm proper positioning. If everything looks good, the trial components are removed and the real stem is then inserted. This stem also has a roughened surface on it that allows the bone to grow onto it. On top of this stem, we place a metal or ceramic ball. This ball is what articulates with the plastic liner and makes up your new hip joint. The incision is then closed in layers and a dressing is placed. I hope this helps you prepare for your upcoming surgery. If you have any further questions, please address them with your surgeon prior to your surgery. Thank you for choosing Jack Houston Memorial Hospital.
Welcome to the recovery room. This will be your first stop after surgery. The recovery room is one room divided by curtains where multiple patients are cared for. To ensure your privacy, visitors are not allowed in the recovery room except in special circumstances. While in the recovery room, you will have a registered nurse taking care of you at all times. We will continuously monitor your heart, breathing, and vital signs. We will assess your surgical dressing and, of course, most importantly to you, your pain. It is important for you to know that you will have some pain. You will not be free of pain, but we will work with the anesthesiologist to get your pain to a tolerable level. Most patients stay in the recovery room for approximately 1 hour. We want to make sure that you are stable, appropriately responsive, your pain is tolerable, and any nausea is managed. After the anesthesiologist discharges you from the recovery room, we will call your visitors and notify them of your room assignment and transfer. We will then transfer you to your hospital room. Upon arriving to the orthopedic nursing unit, you will be met by the nursing staff to orient you to your room and continue your care. During your stay, it is important for us to provide a safe and satisfactory patient experience. The goal will be to maximize your comfort and facilitate your ability to regain independence. You will receive IV fluids and antibiotics for infection prevention. Pain medication will be administered by your nurse for comfort measures. Although you might not be completely free of pain, we will strive to control your pain as much as possible. Please report any pain or discomfort you may have at any time. The nursing staff will ask you to rate your pain on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain you've ever had. Reporting pain as a number helps the nurses know how well your pain medication is working and if any changes need to be made. Other comfort measures we will use to reduce pain are applying ice to reduce swelling and assisting you with repositioning in bed. For your safety and fall prevention, it is extremely important to call for assistance every time you would like to get out of bed. Your nurse and nursing assistant will check and monitor your vital signs often. While in bed, you will wear soft calf pumps to promote circulation. The nurse and respiratory therapist will teach breathing exercises for you to utilize during your recovery period. A laboratory technician will visit daily to draw a sample of blood to assist the medical staff with optimal recovery. Our dietary department will meet with you daily to discuss and assist you in deciding your meals for the day. The nursing staff will provide education and instructions for your care during your stay and at time of discharge. We appreciate the opportunity to assist you with your care and ask that you please let us know if there's anything we can do for you. To Depending on the time of your surgery and the type of anesthesia you were given, you may get up out of bed with the assistance of physical therapy on the same day as your surgery. Our goal for that first PT session will be to get you to sit up on the side of the bed or walk a few steps in the room. If your surgery is later in the day or you have had spinal anesthesia, you will get up with PT the next morning. Surprisingly, most of our patients remark on how much better they feel once they get up and moving. All patients react differently, and we certainly work with you and your individual needs and abilities, but our plan is for you to be walking in the hallway with a walker on that first day after surgery. You may still have a urinary catheter or a drain in place, but we are used to working with that and it won't affect your mobility. Plan to bring a house coat or shorts and a t-shirt or pajamas to wear when you are walking outside of your room. We will give you skid-free socks, but you may also want to have comfortable shoes to wear. Anything low-heeled that is not a flip-flop will be fine. We have a practice set of stairs and we will teach you how to go up and down those. Before you leave the hospital, you will have a written home exercise program and should feel comfortable knowing what exercises to do at home. During your hospital stay, you will be assigned a discharge planner who will help you make plans for your care once you leave the hospital. Our goal for you is that you go home where you can return to your normal daily activities and lifestyle. We also understand that home is where you would prefer to be, and in fact, studies have shown that there are fewer complications if you go home rather to a rehab hospital or a nursing facility. However, if you and your doctor determine that it is best for you to go somewhere other than your home, your discharge planner will assist you with setting up that as well.
To ensure a healthy recovery, your follow-up care when you discharge from the hospital will include a series of phone calls, text messages, and surveys spanning a 90-day time frame. The answers you provide will help us determine how you are doing as you recover, as well as allow us to provide you with any assistance you may need. If you have any questions or concerns at any time during your surgical process, please feel free to call me at 334-732-3654. Again, thank you for allowing us to care for you and choosing Jack Houston Memorial Hospital, where excellence is always our goal.
Jack Houston Memorial Hospital is committed to providing a quality experience to you and your family during your stay. To ensure we are holding ourselves to the highest standards, we partner with an independent patient satisfaction company, Press Ganey. Following your discharge, a paper survey may be mailed to you. If you receive a survey, we encourage you to fill it out and mail it back in the envelope provided by Press Ganey. It should only take you about 5 minutes. We value your input and act on survey results on a regular basis. We promise to keep your information confidential. We look forward to your responses as we continue improving the services we provide. If you do not receive a survey, but would like to share a compliment or opportunity for improvement, please contact us. Thank you again for choosing Jack Houston Memorial Hospital, where excellence is always our goal.